Have you recently been told that you need disc surgery, whether that's discectomy, which is where they clip part of the disc, or you need a disc replacement, or a laminectomy where they fuse the vertebra together, chop part of the bone off, and remove the disc and put cadaver bone in there to fuse it? If you are headed down that road, but you just really don't want to have surgery and you're looking for an alternative, the work we do in our office is called upper cervical specific. We deal with the top two vertebrae in the neck and its relationship to the brainstem, which is the autonomic nervous system in your body. And one of the things that that area controls is postural muscle tone through the body. In most of the disc cases, the reason they've happened in the first place is something before the onset of the disc happened to the neck. One of the joints got locked, the muscles pull out of balance through the spine, and then where the disc sits, because the posture is out of balance, they're carrying more load on one side of the disc compared to the other. And if you live like that for 20 or 30 years, one side starts to wear out and becomes weakened, and then often the person twists and lifts something up and their disc goes, or they're at the gym and their disc goes, and then they end up on painkillers, and worst case scenarios, they need surgery. Now, sometimes surgery is absolutely necessary, but we find in our office that about 80% of disc cases that are surgical can avoid it if they get their upper neck corrected over time, allowing the nervous system and the postural muscle tone to come back into balance, taking the pressure off of those discs, allowing the weight on both sides of the body become more symmetric. And most importantly, the reason the disc, when it's bulged, doesn't pull back into place is the muscles in that area, that spinal segment and through the spine, are tight, and that increases the pressure between the vertebra. And what does that do? You've heard of traction. They're trying to pull the vertebra apart to lessen the pressure, which sucks the disc back in. We're just going at it from a different route by relieving pressure on the cord. The muscles through the spine start to relax, and we find in a very high percentage of these cases they can avoid surgery. So if you're looking for an alternative because you don't want to be cut and you want to try something before you go down that road, Google upper cervical chiropractic, do some research, and if there's someone in your area, get in to see them, get a consultation, and see if they can help.